everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragalmedical. This week we're going to be talking to you about our whole food medical weight loss program. Folks, if you've been offered an injectable medication to help with your weight loss, you definitely want to watch this video, so stay tuned. Okay, Dr. Mike, we're coming up on our first year of introducing our whole food medical weight loss program in the practice with great success, a lot of patients benefiting from it. But we continue to get patients in the door that have either been offered an injectable medication to help with their weight loss or have gone through those injections with horrible side effects. Lost weight has been quickly regained. Let's talk about and let's educate the public about, some of the side effects and some of the dangers and why these patients should really consider seeing us first to learn more about a more sustainable whole food-based medical weight loss program.
Well, you think about the easeability of receiving a medication, receiving an injection to lose weight. I mean, people are struggling with weight gain and being overweight for years and years and years, and it does seem very attractive to try to say, hey, this is an easy way out. But the concept of the way these medicines work, and let's be clear, that initially they were made for people with diabetes and who really needs to control their diabetic numbers, and it's quickly evolved into a weight loss concept. But the concern is, if we don't do things naturally or in a way that tries to reduce the side effects of an artificial means, there's always fraught with potential harm or potential side effects. So these medicines really work by essentially slowing the gut down, not letting the food empty through the stomach, and as a result, it sits there and it may make you feel full. That's why there's a decreased appetite with some of these medications, but it also may go backwards. You may get the side effects of a heartburn or feeling like it's pushing up and giving you this stomach ache. It also slows the rate of which the food goes through your stomach into the small intestine for absorption, and it disrupts the ability for the food to actually get absorbed. So once again, you may decrease your appetite, but you're actually slowing your gut, we call peristalsis, the motor utility of the gut to pass food along to eventually get the nutrition out of the food we eat.
Yeah.
That's not healthy.
No.
If you think about this is getting in the way of the body's natural ability to intake food and get the nutrients from them.
Yeah, and folks, let's stop the madness. If you think there's a medication out there that is going to help you lose weight and making sure that it's going to be sustainable weight loss for the rest of your life without adjusting your nutrition, it's just not going to happen. And just recently, we've seen several patients that have come into the office that have done the injectable medications. One patient right away experienced, nausea and heartburn, so went back to the primary care, and what did the primary care did? Gave him 2 additional medications to help with the nausea and the heartburn. It's just crazy, and that ended up leading to violent vomiting, and unfortunately, this patient lost some weight, but once she came off of the medication, all of the weight came back on, and let's be realistic. This is not an affordable medication to take for the rest of your life. The average cost out of pocket is $900 a month for life. This patient was paying $1,400 a month for 2 years. Just do the math. We have a much easier solution, and something that is big difference is that it's going to encompass a lifestyle component, and that's your area expertise too.
Well, we want to look at nutrition and the whole food plant-based concept. We regulate the processing food. We all realize, we hear it on television all the time, there's a Mediterranean diet, there's different types of diets that really work on mostly plants, minimizing, again, the red meat, minimizing the aspects of excessive amount of animal proteins. But even with that, we have to realize the American diet, the food is processed extremely, and a lot amount of processing is where the harm comes into play. So if we can teach you, if we can educate you the way in which the food that you're eating is in fact food, not processed and have long shelf life, it's absorbed better and it's sustainable again because you're actually getting the nutrients that you're eating. And that's what we're here to do, to teach you how to eat, what foods are best for you, looking at your family history, looking at your body composition, looking at what you have to do in life. Increase muscle mass, just decrease body fat, and increase your cardiovascular fitness, worry about Alzheimer's disease, worry about heart disease. Those things can all be regulated by what food you eat. So that's the concept, is a natural nutrition-based diet, and educating you to how to feel like what you're supposed to be eating becomes sustainable. Because when you just receive a medicine and falsely cover it, and you're not receiving actually the food that you need to be eating, you're gonna lose. You're not gonna actually have the ability to actually sustain that weight loss that you acquired in a relatively short time.
Yeah, folks, if you're looking for an alternative to a medication that you have to take for the rest of your life with all of those side effects, and the side is the expense of those medications over time, you definitely want to give us a call. Schedule yourself a free consultation to learn about our whole food medical weight loss program that covers you with medical oversight for the rest of your life. More information can be found about our practice on our website, maragalmedical.com. And then please consider subscribing to our YouTube channel. We have a number of videos over the last couple of years, patient education videos, which are also a great resource. And folks, the clinic is a physical medicine clinic. We take most insurances, and a portion of this program is usually covered by your insurance. So give the office a call. You'll be happy that you did. Well, that's it for today. I hope you learned something. Have a great day, everybody.
Take care now.